I think you all know from the briefing emails that went out, we are really lucky to have Dr. Elizabeth Cameron here tonight to talk to us about global health security, to talk to us about her career. We'll follow the same format we do every week. We'll start off with a few questions. Unfortunately, Dr. McKean couldn't join us tonight, but we'll start off some questions about your career and what you're working on. We'll then turn it to our students who prepared briefing emails for tonight's class, and that's Allison and Vanessa. And then we'll open up the conversation to the rest of the group. We'll go a little bit about an hour, maybe a little bit more or less, depending on how the discussion goes. My experience is these things, there are many questions, so you'll be ready.
Great.
So,
Can't wait.
So with no further ado, I guess I'd like to just open it up, if I could, Beth, with the first question. Really is kind of look at you. You heard where everybody is in this room tonight. We've got mostly undergraduates, a few graduate students, but you are in this position at some one point in your life, and it would be terrific if you could just give us a little bit of a map about from where you were sitting here to where you are today, and any advice or thoughts you have along the way, and how you've mapped out this amazing career you've had, both in the sciences and policy and bouncing back and forth. So if you could give us a kickoff, that would be great.
Sure. Well, first, thanks very much for inviting me, John, and thanks for the great questions, and thanks for setting them in advance. That was excellent. Gave me some time to prepare and reflect. The first thing I'll say is I did not map out this career in any great, perfect detail, although there were people who were asking me to do that. So I say that as maybe the one and only piece of career advice that I feel qualified to give, which is don't worry about having everything mapped out. If you find great opportunities, and in particular great issues and people that you want to work on, and people you want to work for and learn from, you'll do fine, or better than fine, and you'll be happy, which is most important, I think, and fulfilled. So how I got to this position, and one of the things I'm most excited about, which I did not tell John, is that I got to this position by doing exactly what you're doing. So I went to the University of Virginia, and they were trying out a new format when I was a first year, which was to do 1-credit classes in new and emerging topics and fields that hadn't really been available, and or were fields where you couldn't really get a sense of what the field was like until you got sort of 3 years into classes and weren't sort of sure that you actually wanted to do it. And so the class that I took was called DNA Forensics, and it was when the Innocence Project was first being created, and my advisor, at the time he wasn't my advisor, but the professor that ended up being my advisor, Rolf Benzinger, at the University of Virginia, was launching the Innocence Project. And I didn't know that, or helping launch it and advise it. And so I was also reading books like Silence of the Lambs. I was interested in mystery. I was interested in science. And I thought this is a really cool sort of blend of these two topics. And so I took a run credit class in that, and decided that I really liked genetics, and the Human Genome Project was getting kicked off, and I sort of fell into being interested in that issue. But I was always interested in intersections of law, science, and then later on sort of policy and health. And so I went from not knowing exactly what I wanted to do as an undergraduate to being pretty sure that I was interested in this one topic and in genetics, as the field was sort of exploding with the Human Genome Project. And I was interested enough in that to take it into graduate school, but I still wasn't sure at all that I wanted to work in a laboratory. So I went through 5.5 years of graduate school, and I was happy. Actually, I know a lot of people who weren't happy as graduate students, but I was happy because I chose a small interdisciplinary program that focused on learning about ethics and human genome and issues and genetics. And that made me comfortable that I wasn't just going to be at the bench. So that's another thing, I think, since you're also interdisciplinary, is that there's so many great ways now, I think, to marry an interest in science with an interest in policy. And that's really exciting, because when I was in graduate school, there just really weren't that many opportunities. And people kind of looked at people like me a little bit sideways and asked, why are you interested in this? But I was very fortunate, because people who planned the Human Genome Project planned for an ethical, legal, and social issues piece of the Human Genome Project to be funded along with it. And so that issue area was briefed to us. We had lots of extracurricular classes in ethics and legal issues associated with genetics and biological risk. And those things sort of kept sitting in the back of my head. And when I graduated, I applied for a AAAS, an American Association for the Advancement of Science Policy Fellowship, which is a program available, and Taylor has also done one of those fellowships. It's a program available to people with PhDs in science or medical or veterinary degrees, and it places people in Washington for 1 to 2 years to see if they like policy issues. So I did that, and as a bonus, I ended up with a husband and a new career. So that's how I ended up.
This is a full-service organization.
It is, it is, in my case. And so I did 2 of those fellowships. I landed on Capitol Hill in Senator Kennedy's health office and then at the State Department. And after that, sort of made a career of bringing health and security issues together, and was ultimately detailed to the White House, where I got to work with fantastic people like John and Jimmy and Bruce and many others. And now I'm carrying that forward into my career. So that's how I got interested. And the only other thing that I'd say, just looking out here, I see a lot of women, and I'm really excited to see that. I thought that I'd take just maybe 1 minute to talk about women in science, women in international security, since there's so many people here sort of interested in both, from what you said.
You anticipated my first question,
I did,
so that's
sorry.
perfect. No,
You told me
that's
you might want to say something about it.
And I guess I'd say, don't let the world off the hook. I mean, obviously, love to get advice for our students, but also, what do we need to do to, we need a lot more women at the table.
Yeah, so the first thing I'll say is that I was very fortunate to have a lot of mentors who did not look at me as a woman. They looked at me as a smart student, and they didn't, I never felt like it was a big issue for me. However, there are not enough women in either of these fields. And I've come to realize, sort of reflecting on the time that we live in, that there actually are some barriers. And most of the barriers are because when you go looking for somebody to sit on a high-level panel, generally you look at the person who holds the highest level position. And if we keep doing that, we're going to create a self-fulfilling prophecy that we're only picking people at the highest level who tend to be men at the very highest level of their career. And so what I've realized in the job that I have now, where I get the opportunity to put panels together and conferences together, is that even when I try really, really hard to make a gender diverse and ethnically diverse panel, I often fail. And so I would just urge you to hold each other accountable when you have the opportunity to plan these kinds of events. I've asked my team to hold me accountable, and I'm lucky to work for an organization where our CEO has signed a gender pledge policy, and such things exist. A good example is a gender pledge in nuclear policy that's online that I can share with you, but there are many others that are like that. And I would just say, think about that when you think about who you want to work for and what you want to do. And also just realize that this is a time right now when I think we're fortunate that people are paying more attention to these issues. So it's a great opportunity, but it's also still a challenge even for those of us that are focused on it.
And I guess that makes sense to me, particularly with the sciences. But foreign policy, you've also spent time at the Department of Defense. You've spent time in the National Security Council. I think, frankly, the space, my experience there is that there are a lot more people who look like me than there are any other demographic. And it does seem to me that this is also a moment to think about diversity in that space as well. And I guess your thoughts there. It seems to me it's similar, but I wonder if there's some differences that are important.
Yeah, there are big differences. Coming out of a PhD degree, where most of the students in my class, actually, it was a higher percentage of women in my class, and you may find that in biological sciences still, but I certainly did find that. In the national security world, that is definitely not the case. I will say this: I was fortunate to work in a White House where every single one of my bosses, except for the President of the United States, was a woman. Susan Rice, Avril Haines, Lisa Monaco, and Amy Pope, all women. Laura Holgate, all women. But that was not the norm. And in a lot of the meetings that I attended around the table, particularly when I worked at the Pentagon, I was often one of a very few number of women, and in many cases at the Pentagon in AT&L, which is the acquisition sort of hard, buying aircraft carriers and planes piece of the Pentagon, I was often the only woman at the table. So it's definitely still not there. I will say, though, that there was a lot of focus in the White House when I was there on how to understand why those issues were. Is it that women are dropping out? Is it that there aren't family policies that are friendly for women? Is it that that people look at those fields and don't see anyone that looks like them or talks like them or thinks like them, and so they don't go into those fields? And so I actually think that's a really interesting area of study. And I got interested in talking about those issues while I was there because my big boss, was really interested in those things.
Excellent. Well, I suspect there'll be some further questions down the line here, but let's turn a little bit to one of the, I would say, the signature pieces of work that you were involved in, particularly when you were at the National Security Council, but still, which is the Global Health Security Agenda. And I think it's fair to say that the GHSA has been a success. I would say that it was more successful than maybe some of its commentators even thought at the time. But there are obviously huge issues in getting the world ready, or at least anywhere close to being prepared for the next pandemic. For those of you, we've talked a little bit about this in this class, and there's a few overlapping students here in other classes. I mean, so if you look at international law, you'd think, okay, well, we have a global health security issue. There's a need for cooperation, so we'd have an international organization like the World Health Organization. Like, they would be the lead for something like the Global Health Security Agenda. But that's not the tack that the administration took, though it involved WHO, but it wasn't the lead agency. The same way in recent years in global health, when there have been sometimes specialized institutions are created, like the Global Fund to Fight AIDS, TB, and Malaria, or Gavi, or sort of workarounds, if you will. That's my language to the World Health Organization, others. But you all chose a sort of, I think, a special path. Some academics call it mini-lateralism or a coalition of the willing, but you found countries that were willing to play and be the base. So I guess I'd love to, if you could reflect, why did you make that strategic decision? What does it mean about the other institutions in global health? And are there potentially other opportunities to use this approach on other global health issues? So.
Yeah, it's a great question, and I think I love the term mini-lateral. I think it's great. I hadn't actually heard that term until you put it in an email.
Sure.
It's kind of.
If you hang around these places long enough,
I like it. I like it better than coalition of the willing for a lot of reasons. So I'm going to start using it. So what I started off by saying is that the Global Health Security Agenda did start with strong support from WHO, and that support has waxed and waned. But it's important because the goal was never, and I don't think the goal of any of the other organizations that you put out on the table in global health, like the Global Fund, for example, the goal isn't to diminish the role of the institution, WHO in this case. The goal is to help the institution, and the goal was definitely in conjunction with the WHO Director General, to help the institution with something that was really challenging, a few things that were really challenging for that organization to tackle. And so if you look at the international health regulations, which are the WHO member state signed policy to be prepared for pandemics, there's clearly, a roadmap for what countries need to do, but it's not exceedingly specific. It doesn't include strong metrics. There are 196 countries signed up, and it's really hard to get 196 countries to agree on something. And if you get them to agree on something like the international health regulations, trying to get them to renegotiate a piece of that or to drill down into something as specific as a specific metric that everyone can agree to, especially if you try to do that all at once, it's really challenging, and it can become prohibitively challenging to getting anything done. And so the GHSA really built on a lot of work that was done, not just in the United States, but by partners around the world, to look at the question of how would we actually know if a country was getting more prepared? What does that mean? How do we measure it? And how can we start building a group of countries, a coalition of countries, a mini-lateral of countries that care about this specific issue? And in addition, it's been at that point at which the GHSA was launched in 2014, it had been almost 10 years since the IHR was renegotiated in 2005 after SARS. And at that point, it was clear to everyone, I think, but certainly to people that followed this issue for a long period of time, that countries weren't prepared, that by any metric, by any standard, they were self-reporting that they weren't prepared, and many countries just weren't reporting at all. So when you have an 80% failure rate, countries are 100% supposed to be prepared. There's an 80% of countries that weren't prepared, and many of those countries had no way of getting prepared. They didn't have funding, they didn't have focus, and there also wasn't any political will to get prepared. You're putting countries in a really tough position. And the WHO is in a really tough position because it can't really tell 196 countries that they have to do something with no resources. So we looked at the GHSA as an opportunity to garner political will by getting a few like-minded countries from around the world together who all cared about this issue, and also as a way to bring other sectors outside of health into the conversation, because the health ministers that attend the World Health Assembly are critical for health security, but often they don't have a big political role to play in their governments. They don't have financing. They don't have a direct line often to a prime minister or a president. And so we wanted to get some other people engaged in the conversation who could help. And who could make the case that health is not only a public health and global health issue, it's also an international peace and security issue. So that's why we chose the route that we did. And we also wanted to push the envelope on this issue of metrics. And so there'd been some great work done to look at a few of the IHR capacities and think, how would we actually tell if countries' lab systems were getting better? What would be that metric? And we decided to have a conversation within the US government about that. And we couldn't sort of say, look, the US government thinks that here's 5 things that you should do, and go to the WHO and say, we think the United States thinks you should do these 5 things. It just doesn't work that way with 196 countries. So we talked to a bunch of other countries about this issue, and it turns out there were a lot of countries and experts who really cared about this, but they wanted to be, surprise, consulted. So we had a series of consultations about metrics and what they would look like. And we were able to use the leverage that we had within the US government, partially because certainly at the time we were spending funding and capital on global health, and we were trusted, but also because during the Ebola epidemic that ensued after the launch of the Global Health Security Agenda, we were really leading the effort. And so we were able to say, look, we really care about this, and we're showing we care, and here's something else that we'd like to do. And ultimately, that ended up with a successful initiative, but there's still a lot of work to do.
Well, it's on metrics. It seemed to be another one of the sort of distinctive features of the Global Health Security Agenda's broader effort was not only the development of the metrics, but the notion that countries, by participating, would report on those metrics, but also that there'd be an external evaluation. And that is unusual. And that's a step that doesn't exist even under the IHRs, or at least to my knowledge, in any other global health space. Maybe you could say a minute about what made countries agree to an external review of their own capacity, and what was persuasive there. And because this is an issue that comes up in other dimensions of global health too, again, sort of, are there other opportunities where this kind of a mechanism might work?
Yeah, so there's sort of 2 parts to that question. One is, how did we get any countries to buy into thinking about this issue? And the second is ultimately, how is it agreed, and how are we in a position now, 4.5 years later, where over 100 countries have done an external evaluation, which is remarkable and actually not something I ever anticipated when we launched GHSA. The first thing I'll say is I also didn't anticipate that we would have external evaluations. It was something that within the US government and within other expert communities focused on the IHR, many people believed it was where you want it to be, but no one believed that it was actually achievable, frankly. So how we got there is during the discussions that led into the Global Health Security Agenda launch, we had an enormous number of discussions about how the U.S. government would measure its own success in funding any piece of programming within the U.S. government that fit with the international health regulations. And so we were able to we spent a lot of time on metrics. We got a lot of pieces of our government interested in metrics, and we started talking about the idea of common metrics with close partners, especially G7 partners. And it wasn't very well received, frankly. The G7 partners, who are now, many of whom are now really close partners on the GHSA, really didn't like that idea. And so, moving, further into the initiative, we had to sort of step back and say, here's some metrics the U.S. government likes. We recognize that they might not be for everybody. And we had a series of phone calls where we called a couple of countries that might care about an issue. One example I was involved in, Denmark is very interested in biosecurity. They were really interested in getting some metrics on it. So we asked if they'd be willing to lead a group on it. And we sort of handed it to them and said, here, this can't be USG driven because it looks too security focused. Can Denmark do this? And AMR, antimicrobial resistance, there was a movement sort of starting to get more countries focused on AMR, and the UK and Sweden were really leading that effort in the WHA. So we asked them, could you lead a discussion on what a common set of metrics might look like around AMR? And so we systematically did that when the US government only decided to lead one of what is now 19, but at the time was 11 action packages or discussions around metrics. And so by not leading at all, we sort of ceded some control, but we also gained a lot of momentum from all of these other governments. And so we also gained a lot of friends and allies, the most important of which turned out to be Finland, because they were very interested in health in all policies. And they could see how health and health security fit across their fabric of their government and really started taking a leadership role. So that's one way in which we got to agreement to start thinking about metrics. But really what happened to get countries to agree to be assessed is that on the eve of the day, actually the afternoon following the summit where President Obama talked about the global health security agenda and where we brought countries together to talk about commitments to the GHSA, we had a room full, a much bigger room than this, full of people that had come with their ministers and didn't have anything to do for the afternoon. So we arranged, just bluntly, we arranged a panel discussion with all of these really high-level people who had spent the rest of the day while their ministers were off doing other things and consultations with our ministers. And we put them all in a room and started talking about different things, and one of those topics was metrics. And honestly, former CDC Director Tom Frieden went way off script. We had written talking points for him, and you'll do this at some point in your career. If you go into policy, you'll write talking points for people, and they'll either follow them or they won't. And Tom didn't follow them in this case, and it was a really good thing that he didn't, because he decided to use his opportunity to ask countries to sort of talk about why they cared or didn't care about metrics. And so he said, listen, can we all agree that metrics are a good thing in health, global health? And, many people raised their hand in the room. And then he started asking increasingly more difficult and political questions about external evaluations. And at the very end, he said, this room is packed of people. Nobody knows what's going to happen. And he says, hey, can anybody volunteer to be externally assessed? And these are countries with no instructions to say yes or no to this question. But he sort of left it sit there for a couple minutes, and the couple minutes got longer and longer and longer, and very uncomfortable, frankly, for those of us staffing in the room. And he finally turned around, to go and, set up for the next panel. And countries started volunteering. They felt really uncomfortable. And a few countries said, look, as long as this isn't politically binding and we're not signing up to do something for our government, we'd be happy to host a team of peers who could look at what an external assessment could look like. And those countries were, I'm going to probably miss some of them, but Uganda, Ukraine ended up volunteering later, the United Kingdom, Georgia, Portugal, Peru, really different countries randomly. Because of the political goodwill in the room, and also, frankly, the political goodwill the U.S. had created by leading on the Ebola response, countries really wanted to jump in and volunteer. And so that led to a 6-month process to really try out external evaluations And it allowed an opportunity, I would say, for the WHO to say, look, there is a process, it is working, and then for them to take it on and really, make it their own with some help from experts that were already engaged. So that's how we got where we got. And I think, a lot of that was, some of it was happenstance, but a lot of it was really good leadership.
Well, that's one of the reasons I asked, is I really do want us to, when we think about global health, obviously you think first of as a biological or medical interventions or looking at health issues globally. But I think what you just described, which is the intersection of diplomacy with health, is a really important issue internationally. And I guess, again, given so many people here are interested in foreign policy as well as health, I wanted you to tell that story. I guess the one question that also often comes up in these spaces is, okay, well, at the end of the day, you're talking about influencing leaders that are representatives of countries. But we know that the challenge in health security is political will to invest, right? This is a classic hard political problem, right? You're asking governments to spend money now on something that might happen someday in the future that is relatively low likelihood, albeit maybe terrible impact. But those are things that it's hard for government to do because there's lots of competing priorities. I guess one question I'd love you to comment on is not only how did you get leaders in the various governments to agree to GHSA, but have you seen action in the domestic politics of countries as a result of being part of this, where we're seeing more investments? And just your thought about the interaction between political will at the global level and how it plays out domestically.
Yeah, it's a really great question. So I'll start by saying something that might seem orthogonal, but it's one great thing with the intersection of science and studying science and health is that it provides a little bit of wonkiness in your thinking about foreign policy. And I say that because as a scientist, you spent a good chunk, still the most number of years of any position in my career at the State Department. And we have people like Ambassador Kolker here who spent their careers at the State Department, the first piece of their careers there. It's really good training to also have the ability to sort of drill down on a specific issue. And here in this case, it was metrics. So after we launched the Global Health Security Agenda and got some funding, we were lucky enough to get some funding for it in the middle of a crisis, which was non-trivial and only happened because the President of the United States was really committed to this issue. We then set about working very closely with HHS and CDC and USAID, developing roadmaps with these metrics that had been agreed to actually show, and for countries to actually be able to map out how they were going to spend the money, for us to show Congress how the money was going to be spent, and for countries to be able to actually make the case, here, if these specific dollars are put into this specific bucket, this is what's going to happen. And just to continue to use that kind of language in every conversation, that the reason we believed in global health security and the global health security agenda is because by having metrics, if you put funding in, you know that where to put your next dollar and how it's actually going to help. And we also utilized in a very effective way the chiefs of mission, the ambassadors sitting out in those countries for the United States, got them engaged, got the country teams engaged, so diplomatically got them engaged, and then they got all the way up, in some cases, to heads of state level engaged in this sort of really wonky, metrics-driven process, which engendered a sense, I think, or at least what I heard in all of these discussions with really high-level officials from the U.S. government around the world, is that they had a way to actually explain how and why health security was important, and not only why it was important for preventing, for stopping an outbreak before it becomes an epidemic, but also how it was going to help their health system, how it's going to help them measure across many other programs that were receiving funding from different silos across the U.S. government and other donors, and to really be able to sort of make the case that a dollar was going to get them somewhere. And that was really missing from health security because you couldn't measure the number of vaccines. You couldn't measure the number of pills. There was nothing to really measure and show where the funding was going to go. And so being able to make that argument, I think, was really, really, really helpful. And so to answer your question, have we actually seen additional investments based on this strategy? The answer is yes. I think the jury is out on how effective we, the U.S. government, have been in making the case that each of those dollars that we put in has led to a very specific outcome. I think CDC and USAID, who got the lion's share of that $1 billion, have done yeoman's work in really trying to be able to translate those dollars into very specific things that happened. But we've definitely seen investments from other donor countries. Australia was not funding in this area in a substantial way, and they now are. The Republic of Korea put funding in very early. We're seeing investments coming from countries throughout Africa in their own health security, and also agreements to participate. I mean, if you look at sub-Saharan Africa, almost every country has done an external evaluation and committed to publishing those results transparently online for everyone to see, and are talking within their governments about why they need to make investments. The challenge, of course, is that there's not enough funding to fill all of these gaps, and people are starting to cost out what these gaps mean in terms of investments in donor and host country budgets, and it's substantial. And so what that means is there's still a case to be made for more funding to go in, for us to be able to look at this area of development as a place where additional substantial investment needs to be made. And it's also, the next phase of GHSA also has to be about prioritization. So where are the places that countries really need to put funding in first, keeping in mind that the whole agenda is important, but there's some really specific things that need to be done.
That's really helpful. Because global health operates at all these different levels, it's really important to think through, at least for our students, to think through how devices like the GHSA impact both international politics, if you will, for lack of, and domestic. One thing, before we turn to questions, one thing about your career, both past and present, is that, we've been talking about naturally occurring events so far, but there is a world of both accidental and deliberate actions in this biological area. And I guess, it'd be great if you could just reflect on your sense of where our risks are as a world right now. It does seem, to me at least, that our technological capacity to create and modify pathogens is growing rapidly. And it seems to, I don't think it's too much of a stretch to say it outstrips our political ability to manage these things. So I guess your sense of where the world stands in terms of of the threat of both accidental and deliberate use of biological weapons, I guess, or pathogen, whatever the right word would be, that would be terrific if you could just reflect on that and what role that you're playing to try to address that.
No, sure. I'm happy to talk about that. I'll try not to talk about it for too long. No, it's critical. So I would say this. I think one of the great things about working in countering biological threats, which is how I usually talk about it, is that naturally occurring disease threats, deliberate threats, and accidental laboratory releases all require, if you want to stop them at the source, they require almost the same kind of preparedness. And so it allows you to, if you're interested in security, if you're interested in deliberate and accidental threats, it allows you to work within a community of public health experts in a way that can be and should be really inclusive. And if you think about it, where are pathogens? Where are pathogens of concern? Where is technology being developed? In health and veterinary laboratories, in scientific institutions that work on peaceful biology. And so if you're only engaging the defense and security community when you talk about bioterrorism or when you talk about bioweapons, you're not engaging the right people at all. And so the first thing I would say is if you're interested in this topic, having a background in biology and science and diplomacy is really, really useful because I've been on many trips with defense officials that have no scientific background or no public health background, and they're just not as convincing when they talk to people about this issue. So first, I think it's a great opportunity to be interested in the whole range of biological threats, and I'd encourage you to think about the whole range. I am currently working in an organization, the Nuclear Threat Initiative, where I'm the biosecurity lead, focused on largely deliberate and accidental risks as a particular niche area that we have. But I work with the broader global health community in Washington to build this in as one piece of what we talk about. Not the only piece, not even always the most important piece, but a really important piece. And that approach has allowed for a lot more successful, Washington-based diplomacy, I would say. What do I think are the most important risks? I definitely think that we are fast. When I joined the U.S. government, we were in a period of time where dual-use research was really just being discussed as such. It was just post the anthrax attacks. I joined the State Department in 2003, and there was a lot of concern about the ability to make and modify pathogens at the bench.
Could you just define dual use?
Yeah. So dual use can mean a lot of things. I mean it. In all of biological science is essentially dual use. You can use biology to cause harm, or you can use it for peaceful purposes. Most people want to use it for peaceful purposes. Some people want to use it to cause harm. There's a more stringent definition, which the U.S. government has defined as dual use research of concern, which is very specifically defined by the U.S. government to mean using one of the 7 experiments of concern defined in a National Academies report in 2004, also known as the Fink report. 7 experiments include things like modifying a pathogen to make it antibiotic resistant. These are specific experiments that have been determined to be more risky in terms of their ability to cause harm intentionally or accidentally. And if those experiments are applied to a certain set of pathogens, for example, Ebola or smallpox, those experiments would be deemed to be dual-use research of concern if they are determined, if they are determined to have a substantial risk attached to them. And so it's a bit of a wonky definition that doesn't really translate globally, but you'll hear both of those things if you look into this issue or read reports on it. And actually, all of the information about dual-use issues and dual-use research issues, dual-use research of concern, and all of the U.S. government policies are on a really great website on hhs.gov called S3. So if you look up S3, which I think is Safety, Security, and Science, and you look up HHS together in Google, you'll get to that website. It's very helpful. It's my one PSA announcement, and it's not just because Jimmy is here and worked for HHS. What I would say is the thing that keeps me up at night is that when I joined the U.S. government in 2003, I was looking at those issues as 10 to 25 years down the road, the ability to make something from scratch. We are now in a situation where you can make smallpox from scratch. Not me, maybe not you, but definitely several people on this planet. And we're in a world where the ability to synthesize agents from scratch is not something that we can all currently do sitting here. But most people that work in this field believe right now that that's about 2 years out, that there will be desktop DNA synthesis. There could be desktop DNA synthesis within 2 years. So that means we could be within 24 months of there being a much broader capability to make things from scratch and to modify pathogens more quickly, cheaply, and effectively, which is already here, but not necessarily the easiest way to make something from scratch. So in that world, if you think about the world you don't want to live in, the world I don't want to live in is the world where everybody can make smallpox from scratch and modify it to be, to be vaccine resistant. And that may sound crazy, but that world will come. I believe that world will come. And I think now is really the time to be thinking about what do we want to build in, not just culture of responsibility, which is really important, but also hardware. So where's the technology of the future? Engaging scientists to do science on safety and security. And I think that's something that really excites me as a field of the future. And I'm focused a little bit on it in my current job.
Excellent. Well, thank you, Beth. So now we're just gonna shift to the format where I'm gonna first ask Allison and Vanessa, and then we'll. Shimon, do you want? You've got. You're always thinking ahead of me, so this is great. So, Allison, do you want to start us off? Thank you. Thanks, Shimon.
Of course. Thank you so much for coming. We really appreciate it. Uh, I think the question that I would like to start out with is there's obviously a wide variety of biosecurity threats and just issues in global health security generally. So how are, on kind of the domestic level, how are priorities shaped? So how does the Obama administration decide what it wants to focus on? Is it driven by current events, by personal interest, or how does that work?
That's a great question. So how does any administration decide what policy priorities to work on? So I would say in this, so I'll stick with health security, at least in the beginning, and I'm happy to answer broader questions. But on this topic, so I'll use the example of global health security agenda because it's a good one. So global health security agenda was originally shaped because there was an understanding both within the Department of Health and Human Services, the Department of State, and also at the White House, right around the 10-year mark after the 2005 IHR deadline. People knew that countries weren't going to make the mark, and they were thinking about it both substantively, what does that mean for preparedness, but also politically. What are we going to say that we signed up to this treaty and nobody can actually do it? So how are we going to deal with that issue? And so, several of the discussions which I was involved in before I came to the White House about global health security and GHSA came out of this idea that we needed to think as a government about what it means to not be prepared for the next pandemic. And what that means in the context of not being in an epidemic or a potential pandemic. Part of it was also shaped, though, politically and substantively by the 2009 H1N1 pandemic flu. So when you look at the Obama administration, they came into office, they were hit by pandemic flu. We were fortunate that it didn't turn out to be as bad as many people thought that it would be. But it was really scary, and John can tell you a lot more about that than anybody in this room. And I encourage you to ask him about that. But so that definitely drove there to be an interest in this issue. But what actually I think drove GHSA to get crystallized and formed was another moment. So H1N1 came and went. There was discussion about IHR. It came and went. But I ended up in the White House in 2013, right around the time that Lisa Monaco started as the Homeland Security Advisor, Homeland Security and Counterterrorism Advisor to the President. And one of the first things she was hit with, literally in like week 2 or 3 on the job, was Middle East respiratory syndrome and H7N9 flu and the first human cases in China. And so it was kind of like, oh no, here we go again. What could happen with H7N9? Is this going to be another H1N1? Is it going to be worse? What does this mean? And murmurs, what's going on with that? It's, we're seeing more cases. What does it mean? What if it comes to the US? And she just very diligently held meetings on this. And many people across the U.S. government who were involved in all of these outbreak responses over the last decade, who were in the administration at the time, people like Tom Frieden and Nikki Lurie, came to the table and, not only talked about the crisis of the day, what do we do about these specific 2 disease threats, but they took the opportunity to talk about what are we going to do in the future? How are we going to get to a world where we're actually prepared? And so that is taking advantage of a crisis to actually try to get ahead of it. And that really carried through the next 4 years. Those discussions then allowed us as staff members to say, okay, they talked about it. Now we can go talk to the rest of the government, convene some meetings, come back to them, give them some ideas. And it also allowed us to say in the middle of Ebola, look, we can't just focus on this current crisis when for the last 3.5 years we've been telling everybody we have to focus on getting prepared for the future. And that translated into a $1 billion request that was granted from Congress to actually try to do it.
Thank you.
Great question.
Thank you again for being here. You've spoken extensively about how important it is to prepare for biosecurity threats and as well epidemics, I think. Could you just talk about or elaborate on how you engage communities to prepare for these biosecurity threats? Because you've talked a lot more about how heads of governments are involved, but communities also need to be prepared, I'm assuming.
Yeah, it's an outstanding point, and I would say it's one that. So I do not have a background in community health. I learned a lot during the Ebola epidemic in West Africa about just how important it is to have communities educated and with you. And I'll just say one vignette. Last week, I was talking to one of the leads in WHO in the Health Emergencies Department, who said in the future, as we see more and more he was talking about the Ebola outbreak in the Democratic Republic of Congo currently, and said as we see more and more outbreaks in unstable environments, as we see increasingly pockets of instability in the world that lead to health crises or exacerbate health crises like Ebola in DRC, we're going to have to rely on and train a cadre of experts that are from communities, that are from the continent or the region where outbreaks are happening, who are prepared to go into communities in advance of, during, and after these events, and really bravely, frankly, risking their lives in the case of DRC right now, and Ebola, to educate and build community trust. And it was essential during the Ebola outbreak in West Africa. It's essential, I think, during every outbreak. But what really stuck with me is how unprepared many people in political leadership positions, myself included, quite frankly, were to think about those issues and understand what it would mean to get ahead of a crisis, to actually have to think not just about sort of, quote, community engagement, but community engagement in Guinea as opposed to community engagement in Liberia. It's not the same community. And in many countries across many borders around the world, it's not the same religion, it's not the same practices, it's not the same language, it's not the same people, and the issues that the community is dealing with are very different. And so I think one of the things that really sums up Ebola in West Africa is nobody was prepared for Ebola to happen in West Africa because everyone saw it happening in East and Central Africa. And the issues in West Africa were just vastly different because the people were different, the communities were different, the way of life was different, and that meant that the outbreak was very different. So I'm not giving you a great answer to your question, except to say that I learned the value of anthropology in the middle of the Ebola outbreak, and I think that is definitely a career interdisciplinary, anthropology and health, anthropology, diplomacy, and health that really need to be thought about more together. You've got some experts sitting over there for sure on that topic.
Hate to to what extent do you think part of the challenge was just a lack of so many of the people who do the planning in the global space weren't in the kinds of communities that turned out to be vitally important. It does seem to me, in addition to anthropology, it's the inclusion of people with really diverse experiences to understand how to respond. Is that a fair?
Yeah, I think it's completely fair. And I think it was also, I think it's also hard when a crisis arises that people aren't expecting to have familiar ways to actually bring those people to the table. And so I remember sitting around tables like this one with senior leaders in the US government, where there would be people who would say, we should really be consulting with X, Y, and Z. And there's just a sense of urgency. We have to do something. And we're not, in a few cases, we weren't actually sure what the right thing was. I'm still not sure in some cases if many of those things were the exact right thing in the moment. But there wasn't really a structured way to bring people with the right experience to the table. And so what that speaks to, and there may never be a perfect way to do it, but what it means is you need to have those communities built and that mechanism to engage beforehand. And you need to be engaging them in the planning beforehand.
So, okay, I think we can open it up now to other people in the class, or we can just open up more broadly. So, all right.
Hi, I'm Laura again. And I was going to ask how the discussion among pandemic preparedness can often turn to isolationist or protectionist policies, especially in the United States. And so how do you deal with that, working within the government to make sure that it's really focused on where it should be?
I'm really glad you asked that question. I think it's a really timely issue. Let's think about how I should answer that question. Well, I'll answer it by saying two things. I did think a lot. I have thought a lot about that question. And one of the reasons, without getting too deeply into it, I thought a lot about that question is because I was really, and I mean this sincerely, I was one of the very lucky people in the US government that got to transition in a White House between two presidents with very different policies. So I got a really great sense of what it means to be able to talk about the facts of your issue with no politics attached. And to be able to really think about ways to describe an issue, understanding that you don't want an issue to be misinterpreted. And so very bluntly, as the Obama administration transitioned to the Trump administration, I had to think a lot about how to explain global health security without making it sound like an issue that could be stopped at a border. And I didn't have any reason at the time to believe, well, I had what the president was on record saying during Ebola to think about. But there were a lot of people who came into his administration who really cared about pandemic preparedness, still do, and understand that diseases can't be stopped by border closures. But I wanted to be able to explain that, and I had to think a lot about those messages and how to describe it. So one thing that I think is really absolutely essential is that understanding that most people in national security, I don't care what side of the political spectrum you sit on, most people in national security are concerned with their constituents within their borders. That's just a fact. It's national security means national security. That said, if you're not thinking about national security from the perspective of engaging other governments in their national security and explaining it in terms that make people really understand that you are in it for global peace and security in addition to your own national security, it will be very hard to convince them that you care about this issue as anything more than something that protects you at home. And so it's not just about messaging, it's about what you actually do. And so it's another reason why actually putting funding into global pandemic preparedness is so critical, in addition to putting investments here at home, because we have no idea where an outbreak is going to start. And even if you only care about people that are within our borders, which is not true probably for everyone in this room, and certainly not true for most people in global health, but even if that's all that you felt that you could care about in your job, there's no way that you can get to national security without actually focusing on preparedness around the world. And you can't actually be credible in improving pandemic preparedness around the world if you're not engaging with other governments and if you're not providing assistance, whether it's technical assistance, diplomatic engagement, or actual financial assistance. It's vital. And that's an argument that I've gotten a chance to make a lot more on the Hill in this current position that I'm in.
More questions? Oh, Louisa?
Hi, thanks. So I had a quick question about determining where that funding goes and how you did that through the global health security agenda. Because I know the map maybe doesn't necessarily completely align with where the biggest need is. So I was wondering how you guys went about determining that process and balancing the political and the needs on the ground.
So just to clarify, so I make sure I'm answering the question, do you mean looking at the 17 countries that got the funding and sort of thinking about how those were chosen and where the funding lines? Yeah. So I can answer that question completely. What I'll say is this is the total truth. There was a U.S. government wide discussion about a wide variety of factors. One is where are the biggest needs, and two was what was happening and why did we get this funding from Congress. So Congress gave the funding to the administration for global health security because of a crisis in West Africa. And so almost every, a huge swath of the countries on the list, I think 10 or 12 out of the 17 are in West Africa. 12 of them are in Africa, and I think 10 or 9 of them are in West Africa. And that was absolutely purposeful. And Congress demanded that. They demanded that the focus be largely in Africa and on West Africa. And so And for USAID, they actually put language into the appropriation that said it had to be in Africa. They weren't spending funding for something that a crisis that was happening in Africa outside of Africa. And so, from Congress's perspective, you can see why they asked for that. And from the administration's perspective, we really looked at where there were the greatest needs. And I'm actually really proud of the fact that we didn't shy away from countries where it was going to be really hard to make an impact. So some of that funding, a chunk of that funding, went into countries where we knew that they weren't going to get from not prepared to prepared in 5 years. It just wasn't possible politically, economically. But these were countries that had been neglected. They were big holes in the health security net. They hadn't been engaged. There weren't experts on the ground, and we didn't think that was right. So frankly, that's why a chunk of the funding went where it went. Some of the other countries on the list, some of the countries in Asia and in East Africa, there'd been a significant amount of political and diplomatic engagement as well as financial investment. And the idea there was these are a lot of countries that are doing great work. And what's the next step that could happen with just a little bit more infusion? What else, what other great things could happen if these countries were able to take some of the great creative, innovative work they'd already done and given an opportunity to actually do a little bit more. And so there was a discussion across the U.S. government and with ambassadors and countries about what to do and how to prioritize.
Let's see, please.
Okay, hi, I'm Talia again. So my question was when you were talking about the capacity to synthesize agents and how the timeline really changed from where you thought it was something that would happen more from like 10 to 15 years to now 2 years. How do you anticipate these changes and how do you ensure that the policy on preparedness is always evolving along this timeline and staying relevant?
Yeah, so one thing I'll say is that it's really important for anyone in a policy position, if possible, and it's very hard to do this, to be thinking about the future as well as the current crisis. It's really hard to do that. And honestly, 2 or 3 of the best leaders I've ever worked for are people that have constantly reminded me to get my head out of the current crisis and be thinking about the future and the next issue that might come along. And so I think that's great advice that I was given that I'll pass along, which is it's really easy to get focused, especially in a crazy job at the White House, in what's right in front of you, but that you'll constantly be chasing, the last crisis if you do that and not getting ahead of the next one. So spending time focusing on something like the global health security agenda in the middle of the Ebola crisis was actually not popular with some of my U.S. government colleagues. Not the ones in this room, but there are some who didn't like the idea that we were trying to think about how to get ahead of the crisis. And part of it is because they were very busily trying to solve the crisis in front of them. But I was given a lot of freedom, and many of the people working on this issue were given a lot of freedom to do that. So first, I think spending time focusing on it is absolutely critical. But in terms of specifically focusing on dual-use risks and how to get ahead, I think so I agree with what John said, that scientific advances are moving so quickly that governments really, the ability to provide effective oversight is being outpaced. It's just not possible for governments to provide, it's almost impossible for governments to provide regulations or legislation that effectively oversees advances in biotechnology, at least at this point. Which doesn't mean we shouldn't have policies or that we shouldn't try. It just means that the people we really need to engage in managing risk are the people investing in, using, and developing technology. And so I've spent quite a lot of time leaving government, coming to that realization, and launching a new effort to actually engage some global scientific leaders around the world to come up with new ideas, not just for policies, but really to come up with new ideas technically for how to learn how to identify risks in real time a little bit better, but also mitigate them simultaneously. And it's an uphill battle, especially when you think about funders, people who are funding biomedical research, people who are investing in new technologies, to get them to just spend a little bit of time thinking about risk. It's actually really challenging, but it takes leadership. So we're engaging some people in this space who care about that issue and hoping to make progress on it.
questions. Let's see. Oh, please.
Hi, I'm Amy, and kind of related to what you just said about mitigating those risks from dual use research. I was thinking, just popped into my head, do you think making changes at the school level, like curriculums, kind of integrating more like ethics and bioethics courses and requirements, maybe at grad schools too, would make a huge difference?
Yes, I really, really do. I think that for me, one of the formative ways that I got interested in this issue is because the graduate school curriculum that I participated in required it. And also because the Human Genome Project included an ethical, legal, and social issues funded piece, but that isn't the case for every initiative that pops up in biotechnology. In fact, I don't think it's the norm at all. I think it should be required, frankly. I think ethics should be woven into biology from day one, because at the end of the day, we're playing with life in a very positive way that leads to drugs and vaccines and sustainable development for people around the world, and sustainable food and agriculture. That's why I went into biology, and I absolutely stand behind that decision. But the general public often sees that we're playing with life. And so to be able to explain why we're doing what we're doing is vital. And to be able to know that we're doing it in a way that's safe and secure, I think that's vital too.
Yeah, I'm so glad to hear you reaffirm that, because I'm a bioethics minor, and taking bioethics at Georgetown is required. So I'm just so glad that Georgetown is doing this.
Well, in a shameless pitch for us, I mean, one of the I think one of the advantages of being a Jesuit university and having this long-standing focus on bioethics and its ability to be integrated. It doesn't have to be, it hasn't been, but it's an opportunity that students have here to make bioethics part of what you do. So I'm glad you're taking advantage of it. So I'm looking out here, and I think Madeline, you had a question. And then probably we'll wrap it up after that, unless there are any other. I didn't see any other hands up, but Madeline, you want to?
Yeah, so I was just wondering, I know in recent years the term or the phrase global health security has kind of become a buzz phrase within a lot of US policy and funding bills. And so I was wondering if you view this more as a sincere shift towards a genuine interest and concern about the issue, or if it's more of just a change in the language, and whether they're just using this phrase to frame it in a more attractive way to policymakers.
Yeah, so it's a question I've gotten asked before, but I'll reflect on it maybe a little differently than I have in the past. So I think it's both things. So I definitely think that sometimes people use that phrase because it allows you to engage a different sector of society. So people who are interested in international security, defense, interior ministries, if the word security is in there, you can engage them. It was intended as a way to reflect the piece, not the only piece, not even necessarily the most important piece, but the piece of the health system that specifically pertained to high consequence biological threats that can cross borders and potentially become a public health emergency of international concern. And the reason there was a term, the term was actually, I don't know who coined the term. Jimmy might know. Teresa might know. But the first definition I ever saw was actually from the World Health Organization, not the U.S. government. So I hope that makes people feel better. But I will say, though, that it was definitely discussed, should the term global health security be used? And the other options were, agenda or initiative to achieve the international health regulations. I mean, who around the world wants to get behind at the presidential level an initiative to improve a regulation? I mean, it didn't work. And public health emergency of international concern is a great descriptor, but it's super long. So part of it was, how do we shorthand this to something that has 3 words? But mostly, frankly, it was about talking about the piece of the health system and getting some metrics around the piece that related specifically to the international health regulations, and how to explain that in a way that was not specific only to the health community, but actually brought in all of the other sectors that have a role to play and have resources to bring to the table. So that's why the phrase was used. I think people do, take advantage of that though to bring in other sectors. But I personally think it's really important to have a focus on this one piece. Again, without saying it's the most important piece or the only piece, and not throwing out the rest of access to health care or the health system. I think you need to be able to explain, though, for every single piece of global health, what exactly you're doing, how you're measuring it, and what it actually achieves. Because I think otherwise you end up talking about very fluffy things that are very hard for policymakers to understand. And so it was our way to look at specific metrics. So when I think about global health security, I actually think about the 19 pieces of the joint external evaluation. And for me, that's what global health security is, and that's what the world has defined it to be.
Before we finish, I thought I might invite our special guests if they have any words of wisdom they want to add, or not exactly.
I guess it paraphrases Rahm Emanuel about taking advantage of a crisis. You talked about in the Obama administration, but in 2005, when bird flu was the topic du jour, what got the attention of the then White House and President Bush was Katrina. That they came in, and I don't know what the Bush administration intended to do when they came into office, but they were then faced with 9/11. Then they became the preparedness administration, and Katrina was pretty clear that they weren't. So as the hurricane is washing onto New Orleans, and we're telling them about this bird flu thing, they basically said, we can't let this one go. And if it weren't for Katrina, I don't think that the U.S. government's preparedness would be anywhere near it was, because they saw the devastation there. And the message from the health secretary to the president was, this is nothing like that. A hurricane is a big bad thing that comes and you have to deal with its after effects. A pandemic is just going to be exponentially large and involves every community around the world, and we're not going to be able to come in and save everybody. Therefore, it's going to be a clear need for the U.S. government centrally to do more, and also to this question about communities. Communities are going to have to take this on to some degree on their own, because you couldn't take a white horse to every community.
We've got quite a group.
Different kind of frame of mind, but first to commend Beth Cameron, because she not only was behind all these things and made them work, but I think you can tell from what she's saying that it's because she really understands the topic and cares about it, and has been a great spokeswoman as she has been here. The one thing where I would have elaborated on what you said were this question of, first, how did the Obama administration determine its priorities? And I think we tend to underestimate the actual institutional and personal dynamic of all of this. I think global health security agenda came to being in part because Tom Frieden was so jealous of the fact that DOD had so much more money for global health security than CDC did. And he got allies, which were Beth and Andy Weber in DOD, and they together came to their leaders, and Secretary Sebelius, I know, talked in the beginning of the second administration to Dennis McDonough, the chief of staff of the president, and said, we need to do something about this. We're going to propose something. And they got allies. And so there actually was a meeting that I attended saying, what are the 3 global health priorities of the second Obama administration? And USAID came fully prepared on maternal and child health, and they were ready to take it on, and nobody could kind of resist that. But because CDC, HHS, and DOD had together formed global health security, that became a priority. The third one, which I'm sure you don't remember, was actually non-communicable diseases. And because no one was ready to do it and it really didn't have an institutional champion, we never made that a priority, even though it easily could have risen to the same occasion. So, yeah. But the sort of institutional and individual champions within the administration make a huge difference, and getting those alliances ready before the meeting where the decision is actually made.
Well, on that final point, which I agree with everything that Bruce and Jimmy said, but I want to talk. I just say one final word about personal champions. I think it is fair to say that, but for Beth's passion and ongoing engagement in the Obama administration, we would not have had the global health security agenda. It's just that some individual people in large, it's an executive branch is a big operation. There are many, many people. Nobody does one thing alone, but people who are passionate and are focused and lead can make a difference. So, and you're one of them. So thank you for being here. So I think if I could ask everybody for a round of applause for our